Pacific people here in Aotearoa have been making waves in areas like sports, the arts and the entertainment industries, to name a few.
But Pacific Island health is a problem that our community don't know about it, don't want to admit to, or simply don't know how to tackle it.
Statistics shows that more and more of our people, Pacific Islanders, are contracting fatal diseases, and we're dying faster than nearly every other ethnic group in New Zealand.
It's time to take a stand.
Speak up.
For yourself and your family.
The Pacific population here in New Zealand has prospered, but sadly Pacific Islanders are suffering across a number of health and disability areas. Statistics show that more and more Pacific people here in New Zealand are contracting chronic diseases like heart disease and diabetes, and this is leading to the worst statistic of all, that we, Pacific Islanders, are dying younger. Dr. Api Talimaitonga is the current Ministry of Health Chief Advisor of Pacific Health.
It's an unfortunate situation where Pacific people have 3 times the rate of diabetes as the general population. And with cardiovascular disease, Pacific people have it earlier, 5 to 10 years earlier than the general population.
All too often, Pacific patients around the country simply take their prescription without fully understanding their condition, their medication, and the importance of follow-up visits. In the end, the first visit, the most important, is neglected, and as a result, injuries or early symptoms snowball into a major sickness and costly medical bills.
The first visit to the GP is very important because your GP needs to know about you, your family, your beliefs, your family history, which is very important.
The key is good communication with your doctor and nurse. When I visit my doctor, I listen. Then I question.
Joelle Venderi knows full well what it takes to negotiate the health system. Having been diagnosed with kidney failure in 1999, his weekly visits for dialysis means proper communication is the difference between life and death. Here in New Zealand, we're lucky enough to have Pacific doctors and nurses who can speak a Pacific language, so you should always speak up when visiting your GP. When it comes to your medication, there are simple questions that you should always ask. Why, what, and how.
Why you're needing to take the medication, what you're needing, what is your problem, why you need to take it, and how often you should be taking it. When you understand fully the need to take advice, the medication, you're much more likely to follow the doctor's advice.
Don't be afraid to speak up. It won't kill you. It could change your life.
Many people do come to us and they're not very confident in telling us that, the healthcare professionals how they're actually feeling. One great way is bring in your family member, either a grandchild or your own child, and let them speak on your behalf.
My nana gets sore around her chest sometimes.
Okay,
and I'm worried about her.
Sure. And you've noticed that yourself, or is that something she's told you?
Yeah, it's something that she's told me.
If no one is available to speak for you, then there are other ways to communicate with your doctor.
If you were to come in with a list, even just a little card written with the names of your drugs and what you're taking, that would really help any healthcare professional to help you.
So I encourage people to write down a few things that they want to ask their doctor when they come along. Ask them about the medication. When should they have that next blood test? What does it mean that they have to go and see the specialist at the hospital? I find it, as a doctor, it's really good when people come with a list because it helps direct the consultation.
Finally, always remember, if your loved one is feeling sick, then visit your local GP early. Don't leave it late because your condition will get worse, and there are certain benefits when you visit your local GP.
Malolele, good to see you. Seeing your local doctor or going to your local health centre has a lot of advantages. First of all, they know you and they know your family. They will have your medical notes and the conditions that you might have, the allergies that you might have, and most of all, it's cheaper.
Remember to always visit your local GP and communicate openly with your doctor. When you are healthy, you can look after yourself and your family, so speak up for your health. Being quiet can be deadly.
O le whautuanga mo o tātou tangata Pasifika, e sili ona tā walo su mai tutonu e wa aise ali I fō mai, po se tamaita e fō mai, e malama li le launga ngana, wha malama ti e ti oe le tūlanga o yeilo ngase pe a whai, o maua oe se ngase whai ngatā.
E mama e papa ma, me kaina roko tō I te ora, te tauturu, are alai o kotou ke pati, me pati kotou, ka tauturu I mai kotou, ia e una, I me te ke rai no kotou. Ia e ka ma, tō tātou tumu kino tire e ka ma, ia e ka ma, no ora e tō o kopapa, me kaina roko te tauturu, te were te tauturu.
Ko whaampe ka pau waha tonga, whiwhine mo tangata, whakamore ka pau ke mea mai ke he whakahao koen ko whai. O ko whare I atu hau ki lang maari. Mo tolua na wili fia koe ke o ke he tonge tā. Hau whi maari, ko kakai ko ni, ko kau tonga o ngā o heni, mo tala no whakatonga, pe e lawa awe ko he tonge tā, mo tō ho I whawhine, koe kau tonge tā whiwhine heni. Tō, o wāre au ka te tege pe tō tāusi.
See this number here?
And she's going to do a blood test today, and when the results come through, we can let you know. Okay?
As Pacific people, we're known for our strength.
So, take a stand and speak out about your health.
Speaking out will save your life.
If you are ever concerned about your health, then call 0800 611 116. If you call between 8 AM and 5 PM, you can be connected to someone that speaks your Pacific language. You can then be directed to a doctor or even an ambulance. Speak up now.